The ability to make informed choices about your own body and your own health care is central to a person's overall health and well-being. Safe, respectful and affordable care, including sexual and reproductive health care, is absolutely critical for women and gender diverse people to live healthy and empowered lives. In 2024, we collaborated with Deakin Rural Health and the Centre for Australian Research into Access to understand the barriers facing women and gender diverse people in accessing sexual and reproductive health care in our region. The resulting report highlighted the barriers and allowed us to really understand what the women and gender diverse people of our region were experiencing. That report recommended the need for extensive community and workforce consultation so that we could understand the barriers and the system gaps. So after that initial piece of research, the team at Women's Health and Wellbeing Barwon South West set out to fulfil those recommendations. That's exactly what we did.
In 2025, we led a consultation project to understand what are the challenges and the barriers that women and gender diverse people experience when they're trying to access sexual and reproductive health care, but also what makes it easier for them and what solutions would they like to see. We also asked healthcare providers what makes it difficult for them to deliver care and again what they would like to see to make it easier. Over 450 women and gender diverse people participated in the consultation. They shared openly and vulnerably and we are so grateful for their participation. So there were two parts to the consultation. We started with a survey so community members could share their experience accessing care and service providers could also share their experience delivering care. The second part was following up with interviews and focus groups where we could delve deeper into the challenges and the barriers identified. One of the key challenges was for women that were going through perimenopause and menopause. Women were really looking for more support during this period. So just 18% reported that they had good knowledge of menopause and just 32% knew where to access support locally. So women were looking for more support during pregnancy and following the birth of a baby. It was really difficult for women to access mental health support, particularly in the public health system. And they were really looking for more opportunities for social connection as well. They were also looking for more physiotherapy. Many women had to access this through private care rather than in the public system, which is quite costly and not affordable for everyone. Women were also looking for greater continuity of care in the public health system. And for those women that were able to access continuity of care, it had a profound impact on their experience in the health system. So outdated social norms can really prohibit and prevent open conversations around sexual and reproductive health and would really love to challenge these social norms so women and gender diverse people are able to have open and honest conversations. So participants in the consultation repeatedly told us that their experiences of pain was dismissed. They felt that healthcare providers really minimised or downplayed their experience of pain. So these findings are presented in our new report from both sides of the door, community voices and service provider perspectives on sexual and reproductive healthcare in the Barwon South West.
From both sides of the door includes a series of tangible recommendations that we can really use to make meaningful change to improve access and reduce barriers. The recommendations include some for all levels of government, for health services and for us at Women's Health and Wellbeing Barwon South West. We are so pleased and very proud to present this report to really amplify the voices of the women of our region, to share their stories. We're steadfast in our commitment to really making change that's meaningful for the women of our region.